which we do know statistically that more women choose implant-based reconstruction. So I want to go back to some of the possible risks that can happen during implant-based. Can you explain to us physiologically about capsular contracture? Because I know that is a possible risk with implant-based.
Yeah, so capsular contracture is the biggest risk that we have long-term with implant reconstruction. That's probably the number one reason for needing a revision surgery to adjust things. Whenever you put anything foreign in the body, you see it when you get, you can get a splinter in your finger. If you don't remove the splinter, sometimes it just gets, scarred around the splinter, and the splinter stays in your finger.
Mm-hmm.
The body walls it off. It reacts, forms scar, and walls it off. There are plenty of war veterans walking around with bullets in them that aren't causing any harm. The body just walls it off. So you can think about a breast implant as the same thing, more or less. The body creates a capsule of scar around the implant. It recognizes it as a foreign object and it walls it off. Now, in some women, that scar capsule remains very soft, it's very thin, they don't even know it's there.
Mm-hmm.
Other women develop a very aggressive reaction in the capsule, and the scar gets thicker and thicker and thicker over time, and then it squeezes down on the implant, and it can deform the implant, it can change the shape and look of the breast, it can make the breast tight and elevated and what we call contracted, and it can even be painful for some women. Mm. So even if women tolerate the change in appearance over time, because it's not that bad, sometimes it's the discomfort that's caused that's a trigger for them to want something done about it. And so we actually see a lot of women that have had implant-related issues, and the number one is capsular contracture, especially after radiation, because implants are performed in conjunction with radiation all the time, but there's no question, there's a lot of evidence out there showing that implants do not do well when radiation is in the mix. Either putting an implant in someone who's been radiated or doing a reconstruction with an implant and then radiating it. You can do it. Plenty of plastic surgeons do it. There are lots of women in that situation, but there's no question that the radiation increases the risk of implant-related problems, especially capsular contracture.
Mm-hmm.